Welcome to the Rural in Reach Westlink series. This morning we're going to talk about mental health and youth. This is a huge topic and it is as a result of a request from rural communities. With me today I have Nicole, who is a social worker, has worked extensively with young people and their families. Sarah.
Hello.
Who has a public health background and an interest in sexual health and young people. And Tess, who also has a mental health background and has majored in psychology. What I want to say before we start this presentation today is that some of the things we may talk about could bring up some issues for those of you who may be watching. So the Rural in Reach program offers counselling and support to people in rural and communities, and we have a 1-800 number which you can contact us on. This number and other support numbers will be broadcast at the end of this presentation. So what I want to do is to just start an open discussion amongst the panel about what we mean when we talk about youth and young people.
Yeah, so I think youth is a really broad term and we hear it a lot, and you know, it's a big question. What is it? Well, I mean, for me, it's the period of time between childhood and adulthood, but it's linked to a particular mindset as well. You know, someone's attitude, their lifestyle choices, and their level of maturity. I think what we do know definitely for sure is that it's a period of time in someone's life where they go through an awful lot of change.
Yeah. So what sort of changes would a young person be experiencing?
There's like social, emotional, physical changes. Like a big part of being a young person or going from being a child to a young person is the physical and, you know, the hormonal changes. And in my experience of working with young people, it's generally from 8 years right through to 25 years that I would class someone a young person.
Yeah, which puts Tess and I in that category.
Yeah.
But I think quite often we probably, well, I know for me, I wouldn't always classify myself as being a youth in certain settings, but not in others. So it's quite fluid, isn't it?
Yeah, definitely.
Yeah. Okay, so Tess, what does the term mental health mean?
Janet, mental health is a huge topic, but I guess in general terms today, mental health good mental health is having a sense of well-being, self-confidence and self-esteem. And it's about being able to enjoy those people around you, the relationships that you have, your day-to-day life and your environment. And on the other end of the scale, mental health problems or mental health illness is a significant health problem that affects the way that people behave, think and interact with other people. There's multiple different types of mental health illnesses, and these are diagnosed based on standardised criteria, and each of them has different signs and symptoms and different degrees of severity.
Yeah, that's true.
Yeah.
What about mental health illness in young people? What does that look like, Nicole?
Well, there's a term that gets bantered around, prevalence, and when that's said, it's talking about what's the highest experience, the most common, and when we talk about mental health illness, the most common experiences or incidences of mental health illness is actually in young people. Like Tess said, you know, when you talk about mental health illness, it is something that's diagnosed by a GP or a health professional, but it's basically like a ticker box thing, like it's the difference between someone having a hard time and not coping and someone who has challenges happening in multiple areas of their life, like, you know, what they're thinking, how they're feeling, and their ability to go about their daily responsibilities, whether that's school or work. It's really difficult to diagnose because the most common experience is in young people, and there's so many changes happening, like Sarah said, at that stage in their life. So, you know, is it a normal experience of being a teenager where there's all the hormonal surges, you know, difficulty getting up out of bed because you just feel like sleeping all the time, or is it actually someone who is experiencing a mental health illness or a challenge at that time? It's difficult.
I imagine that would make it very difficult also for families and loved ones to get a sense of what's happening with their young person.
Yeah.
Definitely very difficult.
Absolutely.
Okay, so there are lots of different mental illnesses, I guess, out there, but we're going to sort of look at some of the more the most prevalent, I guess, so the ones with the highest incidence of diagnosis. And Tess, tell me about depression. What does that mean? What does that look like?
I guess when we're talking about depression, it's important to remember that it's very normal for people to feel sad, low and moody from time to time in reaction to daily life and experiences. But a person who's suffering from depression as an illness will be experiencing these feelings intensely for a long duration of time, and sometimes for no particular apparent reason. So a person who's suffering from depression would be feeling things like low self-esteem, they may be feeling tired, they may be experiencing lack of sleep, they have altered eating patterns, they may have lost interest in work and their normal day-to-day hobbies. So when someone is diagnosed with depression, they'd be feeling or experiencing things from physical symptoms to feelings, thoughts and behaviours. And these would be experienced, like I said, over a long duration, so at least 2 weeks and ongoing.
And it's the sudden change, isn't it, as well? Because it is difficult to identify. Janet was saying, as a family member, to distinguish between it being normal teenage or not. But it's looking out for those concerning changes.
Yeah, absolutely.
And a difference in routine as well. It's anything that you might have a teenager who is, generally speaking, incredibly moody. But if it escalates to to a point where it seems not normal, then
that's right. Because
I guess
normal's relative.
Affecting the day-to-day life, normal activities is when.
Yes, that's true. So another one that we're going to talk about today is eating disorders. Sarah, what are your thoughts on that?
Yeah, so the reason why we're going to talk about eating disorders today is because they do have that high prevalence that we discussed, and they are an increase in young people as well. So I think the most important thing to note around eating disorders is that they are a mental illness. It's not a lifestyle choice or a diet or a fad. It's a mental illness, and often we hear, particularly young people, but even adults saying, "Oh, look at that girl. She's so thin. She must have an eating disorder," and that's not necessarily true. You can't look at someone and diagnose an eating disorder. It's quite complex. But we'll keep it quite simple today. And an eating disorder is characterised when eating, exercise, or body weight and shape become an obsession in someone's life. There are lots of different types of eating disorders that can affect a person, and we're not going to go into all of these types. But in general, eating disorders are linked to low self-esteem, and that is often an attempt to deal with underlying psychological and emotional and mental issues through a quite an unhealthy relationship, often with food. But it can also be with exercise as well.
Yes, they do seem to go hand in hand sometimes, don't
often.
they? Okay, so the next one we're going to look at is substance use disorder. Nicole, if you'd like to talk about that.
I think it's a really complex thing to talk about, especially when I think it's fair to say that there's a normalised experience of alcohol misuse in Australia. But what we're talking about here is levels of harm. Not everyone who uses alcohol or other drugs has a disorder. So substance defines alcohol as well as other substances, legal as well as illegal. Although I think it is important to say that it is recommended that anyone under the age of 18 is at risk of harm using alcohol and other drugs, because like we said, use can be defined from 10 through to 25. That's when it's thought that the brain stops developing. But having said that, that kind of veers us into this whole other discussion around the legal age of drinking, so we won't go there. So just in terms of levels of harm, it's the easiest way to think about it is the 4 L's. So love, liver, livelihood and law. So love's about relationships, so the impact of alcohol and other drug use on your relationships with friends, family, co-workers, peers, that kind of thing. Then you've got your livelihood, and that's your ability to continue going to school or to work. Then you've got liver, so that's the physical impact that the alcohol and other drug use is having on you. And then there's law, so the use having an impact on you getting into trouble with the law, basically. There's been a lot of there's been a shift towards it being a disorder opposed to is it an addiction or is it a dependence, but basically it's all been lumped into the same thing now, and it's just looked at across a spectrum of the impact of it upon you if you don't have it. So from I don't know about you guys, but I feel really sluggish in the morning if I don't have a coffee, right through to having full physical reactions of shakes, vomiting, or being unable to get up and go to work if you don't have alcohol or other drugs.
So just to clarify, Nicole, so a substance use disorder would be diagnosed if you were seen to have a problem which fits those 4 categories. So it's affecting all those 4 L's, is that correct?
Yeah, pretty much. Like, so how Tess was saying that there's a criteria, or how I said like tick a box.
Right.
Basically, it's that if you're having 2 or more in those areas with any mental health illness or disorder, 2 or more of a certain criteria, and for alcohol and other drugs, it's around those 4 L's.
Yeah, I agree.
That's a really good way to remember it, isn't it?
Yeah, the 4 L's. It helps me to be able to understand it. And also with substance use disorder in particular, it often co-occurs. A lot of mental health illnesses that in general co-occur, and with substance use disorder though, it can mask the other underlying mental health illness, especially around, particularly in males. We're seeing with the common experience is that there's a higher incidences of substance use disorders in males than other mental health illnesses that we'll talk about, and that's thought to be because it's harder to admit that you're having a problem and use alcohol and other drugs to be able to cope.
Tess, you mentioned depression, and we talked a little bit about that.
Yeah.
But what we didn't say there was that it often goes hand in hand with anxiety.
Yeah, absolutely.
I'm wondering if you want to enlarge on that.
Yeah, anxiety and depression tend to co-occur a lot alongside each other. Again, when speaking about anxiety, it's important to remember that it's very normal to feel stressed and worried as a reaction to daily stresses. It's when someone who is suffering from an anxiety as an illness would be experiencing these feelings intensely again for a long duration, or finding that those feelings don't subside. And they may be experiencing those feelings of anxiety for no particular reason or cause. Yeah. And I guess that they would be having a disabling or impacting on their life quite immensely, yeah.
How would someone present if they were suffering from anxiety, for example? How would we know that was what was happening for them?
Yeah. I think some of the main physical symptoms are having a racing heart, tightening of the chest, hot and cold flushes, sweating, wobbly legs, all those sorts of things. And I guess that's when the fight or flight mechanism comes into place, and I feel like it's a reaction or a way of managing or coping when you feel uncomfortable or unsafe, basically.
Yeah.
When I used to work with children and young people, and they would present with high levels of anxiety, I would talk to them and their families, helping them to understand what was happening around the anxiety, that it was the body's way of sending a message, so like a warning sign that they're not feeling safe for whatever reason.
Yeah, and once again, anxiety is diagnosed through the number of symptoms from the different categories and by its intensity and duration.
When young people are diagnosed with a mental health disorder, they may use different ways of coping with this, some of which can be exhibited as high risk. So I'm just wondering what what sort of high risk behaviours could we expect to see from young people?
I think that one of the main ways that young people cope is through taking illicit drugs and alcohol as a way of, or a mechanism of coping with their daily stresses or life experiences, basically.
I think alongside that as well becomes, it's high risk sexual behaviour as well can co-occur along, in a party situation. And I guess that relates to bad choices, just generally making bad decisions.
Poor decisions,
whether it's around sex or getting in a car when you shouldn't be getting in a car, or walking home when maybe you really should be getting a lift with when you should be calling your parents rather than being by yourself, and just poor decision making.
One of the high risk coping strategies that I've come across a lot is self-harming.
Definitely on the increase, do you think?
Yes, it is showing that there is a higher level of people in general, but particularly young people that are using self-harming or non-suicidal self-injury as a way of coping.
What is it then about these risky behaviours that young people use? How does that help them cope and manage with what's going on in their lives?
Well, ultimately it's about control over external factors, and it's a way of coping with strong feelings. We all have them, but sometimes they're so overwhelming it's trying to be able to cope with it, and these risky behaviours are unhealthy ways of being able to cope. What I've heard young people say in particular around self-harming is that it helps them release those strong emotional experiences that they're having, like a physical release or sometimes an escape, and sometimes they don't feel at all emotionally, so it's a physical way of being able to feel.
It seems to me that all of the coping mechanisms that you've talked about just now are ways of masking or blocking those emotions and uncomfortable feelings that people can have, particularly associated with mental health and illness. And they are risky. Some of them are definitely risky behaviours. So with anything that we do with an element of risk, there may be a consequence. So let's talk a little bit about that.
Well, I think there's a number of different consequences that come with all those risky behaviours, and the main one being that it can actually worsen the underlying mental health problem that's existing. Also can have a physical health effect on the individual. I mean, taking illicit drugs and alcohol ongoing can be detrimental to your inside and your organs. As we're speaking about youth today, taking drugs and alcohol underage and partaking in sex underage also can bring up consequences with the law. And I guess by coping in those ways, it develops this ongoing behaviour of how to manage with life stresses and experiences, and they can become long term.
Like a long term way of coping, even when you're an adult with something.
Yeah, and I think that's a consequence in itself if you develop this way of managing, and it is risky.
And on that as well, the relationships, the consequence could be poor relationships with your family and your friends, and if you develop those unhealthy coping mechanisms and they follow you throughout your life, then you might always struggle with developing good relationships with friends and family.
And there's also the fear or the real experience of judgment and stigma labels. That's definitely a potential consequence as well.
With that in mind then, what can we do as concerned onlookers or, family or friends to help keep people safe?
Ultimately, just letting them know that you're concerned is the first step, and that you want to help them, that you want to be able to support them. Recommending them to visit a GP or a health professional is the next step, and if appropriate to offer to go with them as well. And I say appropriate because this is a really important time to ask the question, are you the right person to be supporting them the whole way through here? Do they see you as a safe person, as a trusted person, or would it be more appropriate to to recommend that they talk to another family member or possibly a teacher or someone like that, so that they can have someone where they're not feeling that additional pressure, I suppose, is what I'm saying. You know, I think it is okay to actually acknowledge that you might be too close, that it might be better for somebody else. You might have your own reactions coming up. And in that case, I think that it's important to say also that sometimes, regardless of how old you are, that you may not want to get help, or they may not want to get help. And that can be really difficult, can be a really powerless place to be if you can see someone that you love and care about struggling and they don't want to get help, or they don't want to acknowledge that they're having a hard time coping. So in those instances, it's really important to get support yourself, whether it's support around what's happening for you or just support of where to next to be able to help them.
Yeah, that's a really valid point. I think what happens often is we're so busy trying to fix everything and make it right for the person who's obviously in trouble, and often forget about ourselves as well. So that's a really good point, Nicole.
Thanks.
So what can we do to encourage young people to make positive changes within their lives, and how is the best way to go about that? Sarah, can you talk a little bit
so
about
a lot
that?
of points Nicole's already made, and she made a lot of really great points. It's really about encouraging that professional support, for a young person. It's about letting them know that you're available for them, and that you're hearing them, that you're struggling, and letting them know that you're there if they need some help. So it's about being persistent but not pushy, asking them, reminding them that you're there for them, but not to the point where you're...
Well, you don't want to create more pressure.
Exactly, and you don't want to irritate them, especially teenagers. They tend to be grumpy anyway. You don't want to cause a fight. Having said that, asking them once and them grunting at you, and then thinking, I'm never going to ask them again. That's also, not the best tactic either.
Persistent.
There's nothing wrong with asking a couple of times, without not wanting to cause an argument. The last thing that I would stress, being a health promotion officer, would be those healthy lifestyle choices. So diet, exercise, and sleep. Without those three elements, you're going to struggle with any kind of illness, whether it's mental or physical. And it's really important for young people, because they're growing, they've got puberty going on, that they have those three elements in their life.
I also think it's important yourself as a family member or as a friend to be reflective on your own behaviour. How are you coping? So role modelling, showing them that there are healthy ways to be able to cope to stress and challenges in life.
And that's particularly important when we speak about eating disorders. Really be aware of your own behaviour and how you're reacting to your body image and your body, because that rubs off on young people.
Okay, so this raises a question for me around role modelling. I think as parents or as concerned family members, we're all trying to do the best job that we can at the time. So I'm just wondering what the panel thinks about that.
Yeah, I don't think it's about saying that parents are not doing the best job that they can. I think that generally speaking, all parents try and strive to do the best job that they can. But sometimes there are opportunities to grow and to learn. We don't stop learning when we hit 18. You can learn throughout your whole adult life, and there's nothing wrong with sometimes admitting that you need a little bit of help. And Nicole pointed that out.
Who are you? Are you the right person? It might be too confronting, and it's an opportunity then to see who else is in their lives that they have a connection with, who is knows some healthy ways of coping, to be able to, like Sarah said, a learning opportunity basically.
Don't see it as a deficit or as a reflection on your parenting. See it as an opportunity to learn,
and a way of understanding mental health and why young people are experiencing and feeling these things.
So I guess what I've got from what you've just volunteered is that if you've tried to approach your young person and that hasn't worked, then providing them with other alternatives or options on people to see, people to talk to, someone that they can trust. Because I think when all said and done, what we all want is a healthy, happy outcome for people when they're struggling.
Definitely.
Yeah. Sarah, what existing factors might exist for young people which could contribute towards their behaviour?
Yeah, like I said in my first response, there's lots going on for young people, you know, not only physical but, you know, social and lifestyle changes as well. Their bodies are changing, they're going through puberty, and they're trying to find their own identity and place in the world as well. Working out how to get along with family and friends. They're having more mature relationships with people. And they may be dealing with a lot of quite large issues, things like sexuality and bullying as well, maybe, you know, coming into their lives also. It could be a tough time.
Yeah, definitely. So I think bullying is topical because it's actually International Bullying Day today, and I heard Maggie Dent on the radio this morning giving lots of really down-to-earth, well thought out advice and different options for young people to access and their families. But Tess, I'd like to hear what you have to offer around that today.
I think that bullying, there's a stereotype of bullying that it's always physical, like getting pushed around in the playground. But in society today, emotional bullying is very, very prevalent. For example, can be talking about others behind their back, peer pressure, and even exclusion. And in society today, it's happening a lot via social media, through things like emailing and texting, Facebook, Instagram, Twitter. And unfortunately, bullying is something that occurs across the entire life. It's not just experienced by young people. And it can affect, you know, all different aspects of life, including relationships, you know, work life, school life, things like that.
So do you think that it can make mental health illness worse, or do you think that it can kind of bring about a mental health illness?
Look, I think, bullying is something that will definitely challenge the resilience of a young person. It could certainly worsen an existing mental health problem, or it could create one.
Yeah. But I don't think that bullying's new. Personally, I'm a little bit older than my other panellists, and when I was in high school, bullying was definitely huge. Wasn't named that so much, but there was definitely the hidden bullying, like Tess was saying. It's not so much in your face physical, but it's that underlying. And I think that there's something really positive to get from the fact that, you know, there is this perception that it is getting worse. I just think there's different ways to be able to do it now, more obvious ways through social media, and I think that it's good we're talking about it. I think it's great that it's more in the media, like, you know, on the social kind of level, that we're having conversations about it, because that's the first step towards challenging it. And from there we can hopefully not only build resilience, but also hopefully stop the experience.
It's funny that you use the word obvious, you know, in terms of it's more obvious now, and I agree with you, but I don't in some ways as well, because of social media and texting and email, a child can be getting bullied and they're not coming home with bruises anymore. You know, it's quite difficult to see when a child's getting bullied, and they can hide it from their parents, and I'm not really sure what we can do about that.
So maybe it's not so much obvious, it's more that you can't escape from it.
Yeah,
you know, it's like it's just it's there in your face when you're around your friends, but also it's in your room, your safe place. You know, that's the ideal. Is that when you go home, you are safe. And if you're on, I don't know about you guys, but I know I have a teenager, and she's always on her phone or on the internet and things like that. There is no escape if that is a space where there's bullying happening.
Absolutely.
I think what that brings up for me, being an older parent, as in my children are not teenagers anymore, is that it's about monitoring and being vigilant about what your child is doing on social media, so their access to it, being able to check what they're looking at or what they're involved in. And that's not spying. I think what we tend to forget as parents is that access to technology is a privilege, not a right. And it's very important for parents to draw that line in the sand about their children's usage, and be confident that that's the right thing to do.
That's a good point, Janet.
Nicole, what other factors could contribute towards young people feeling vulnerable?
I think there are several others, but before I go into those, I just want to highlight that sometimes it can be really helpful to have an understanding of why or what for, around things that happen, particularly around mental health illness in young people, but also sometimes it can increase a feeling of guilt or powerlessness. Particularly for family who are seeing someone that they care about struggling. And this, again, is another opportunity, I think, to look at getting some support for yourself, some information even around, mental health illness and things like that, because you can only do your best, and I think you said that really well before. But having said all of that, there are some risk factors that haven't been mentioned, but also there are opportunities for resilience. We've talked a bit about learned behaviour here, around learning healthy ways of coping, and I think that there's both sides here. So, a young person's environment, relationships with family, and there's positive and negative experiences in that. So negative is, sometimes people split up, so divorce, separation, and then the other end is child abuse as well. Experience is definitely a risk factor of mental health illness, but then there's positive as well, so learning those positive ways of coping in those environments, home as well as school. Then there's the psychology, so where that person's at, and we've talked a lot about developmental stage, the changes and stuff like that. It is a risk factor. Then there is the family background, so family members having a mental health illness themselves definitely can make a higher risk of getting a mental health illness
having
yourself.
a predisposition, isn't it?
Yeah.
If you use that quite technical term, but
yeah, or more susceptible, things like
better
that.
word.
But also it can be an opportunity for learning as well, of seeing how someone copes or manages with a mental health illness in a healthy way too. And then you've got your external factors. So we've talked a little bit about social media, and hasn't come up yet, but particularly around the high risk coping strategy of self-harming. There is some discussion around it's a learned behaviour, like there's something called a cohort effect. So I think that's a bit of a grey area personally. I think that yes, it can be risky because we do often learn behaviours, positive or negative, from other people, but also there's the flip side of that where it can have a normalising effect.
Yeah, so when you say cohort, what do you mean by that? Is that like learning from a group? So if one person does it, then you copy. It's a copying.
Yeah, definitely, like copycat behaviour.
Okay.
Yeah, that's definitely where that comes in, where you learn how to cope because that's how somebody else is doing it. But I think that there's the flip side to that as well, where it can be normalising. It can also be, somewhat reassuring that other people understand where you're coming from. And then there's factors of like social discrimination factors that are already there anyway, but again, it's a risk factor. So, cultural background, where you live, geographical isolation, so your access to support can be a factor, and information, financial background, and then Sarah mentioned before around sexuality. If you're having, if you identify as gay, lesbian, transgender, or bisexual, that's definitely a risk factor for mental health illness as well.
That's quite an extensive list.
Yeah, there's lots, and also, we've mentioned it a bit before as well, stigma and labels, either the fear of it or admitting that you're having a hard time too.
That's true. Yeah. Stigma is a word that's bandied around a lot, and I'd like to open that up to the panel so that we can get your thoughts, separate thoughts around that.
So yeah, like Nicole said, we've mentioned this word stigma a few times, but what actually is it? It's for me, it's about negative stereotyping and labelling. It's about putting a certain kind of idea on it. So in this case, it's a mental illness, and that mental illness may be attached to certain connotations involving, what it might mean.
Yeah, like you're crazy.
Yeah,
mad or
and that's it. It's usually negative.
Yeah.
Generally speaking, stigma is not related to positive. It can cause feelings of shame and distress, and it can often stem in a reluctance to seek help. And so because of that, it can be incredibly damaging to have a stigma around something like mental illness. And particularly young people, incredibly damaging because they're generally very influenced by external factors and their friends and what people think of them, and much more so when they're young than when we're an adult, we have more of our own person. When we're young, our whole lives, generally speaking, revolve around what other people think of us, and so you know, if they think that there's you know, that they might be mad or crazy, you know, they're much less likely to speak out.
Yeah. Well, I think that by us talking about mental health today and mental illness in such a comfortable way, it's helping to break down that stigma and make it more acceptable to talk about and to seek help and support and information around mental health and mental illnesses.
We want to talk about it in the same way we talk about other illnesses like cancer
absolutely.
and heart disease, and you know, it needs to become more normalised.
That's right. Yeah, I agree.
That's great. I've noticed as we've been talking today, the word resilience has been mentioned a few times. I think that's a pretty complex word. From my perspective, resilience is about developing an inner strength, if you like, to manage and cope with difficult situations as they arise. It's not something that we're innately born with. It's actually, I believe, something that we develop. And I'm wondering what thoughts the panel have about that.
Yeah, I agree. I think that's a really good way of putting it. The only thing I'd add to that is learning how to bounce back. That's how I would explain resilience to a child or a young person, is learning those skills, like you said, to be able to bounce back. And I think the key to that is feeling the feelings. We often feel really uncomfortable feeling these strong feelings. That's why we even started talking about the risky coping strategies that we did today. So learning safe ways, so ways that basically don't hurt yourself or other people, to feel the feelings, and one of those is always accessible as long as you can find somewhere safe to be for yourself, is to cry. Actually allow yourself to cry, give yourself permission to do that.
Yeah. And do you feel this resilience would be developed through experiences or challenging experiences, I guess, throughout life?
Yeah, definitely. I think we've said a bit today, all of us, around learning opportunities, learning healthy behaviours and things like
Managing
that.
all those sorts of things have come up a lot.
What gets, I think, brought up for me in the media, and people may have seen it a lot in connection with this word resilience, is that we model collie children now. Tricky word to say. And you know, we don't let them lose, and we don't let them fall over, and we don't let them play with other children, you know, in this fear.
We don't let them hurt.
No, that they may get hurt, and then later on in life, inevitably they will get hurt, because that's...
And then feel resentment. Hang on, I haven't felt that feeling before.
Yeah, what is this losing thing?
Yeah.
You know, what is this losing thing about? And so brings up all those kind of
So it's learning ways to be able to bounce back when, you know, stuff does happen. That, you know, the only constant thing I think in life is change. You know, you can rely upon that to happen, and being able to bounce back when things don't go the way that you expect them to go.
I think the key that I heard from you, Nicole, was to express your feelings in a healthy and positive way, rather than, you know, acting out.
And ways that hurt
risks.
yourself or other people. Yeah, definitely.
Yep. Okay, great. That was good feedback. The last thing we wanted to just touch on today was, where can people go to access help and support if they're having some difficulties?
The first place I'd suggest is going to see your local GP, preferably a GP who is interested in youth and mental health.
I think a way of ensuring that, and it's tricky in rural areas because you may only have, well, you may not have a GP at all that you can go to, but you may only have one. But if you're lucky and you have the option of having a few available, or there's a medical practice, is phone up and say, or, you know, I'd like to see a youth-friendly mental health GP, and they should, you know, give you an appointment with the best person suited, because unfortunately not all GPs are mental health friendly. You know, we'd like to think that they are, and most of them are, but you know, I really encourage a young person, if they go to a GP and they don't have the experience that they were after and they don't feel heard, to try and seek some alternative help.
Yeah, and to build on that, we've talked a bit about online or social media and stuff like that. But online is a legitimate option for support, and we've got some information at the end that'll come up, some websites that are helpful for and good sites for information.
Yeah.
And also, I suppose, a bit of a shameless plug for our program. If you don't have access to health support in your community, or you feel a sense of stigma or shame around that, you can please feel free to give us a call on our 1-800 number, and we can talk to you about some other options to get that information and support.
Definitely.
Great.
I mean, it's also important to find support in your family and friends, or somebody, an adult who you feel comfortable opening up or speaking to.
Very
as well.
Maybe even your school counsellor or
Yeah,
chaplain.
absolutely, yeah.
Someone that you trust.
Someone you trust, I think.
Yeah, that's the key.
Yeah. I wanted to emphasise at the end of this presentation that it is a very broad topic, and we haven't gone into it in any great depth. So if anyone has any questions or queries, or wants to chat to Nicole or myself, then please call us on our 1-800 number. And Nicole, I'd like you to go through the list of support services for people.
Yeah, I said before that online is an option, but there's also phone support as well. So some of those options are Lifeline, the number you'll see up there, that's 24/7. There's also the acute response team. It's a 1-800 number there. Even though that is here in the city at Princess Margaret Hospital, it is a number that you can call statewide if you are concerned about some of those high risk coping strategies that we talked about today. There's Kids Helpline as well. The numbers up there, that's phone as well as online support for young people, from 10 right up until 15. And then there's also Reach Out, that's for young people, more teenagers, 15 to 25. And the last one there is the Butterfly Project. If you just have a look at that website, initially it was developed for eating disorders. It's also something that has been really helpful for self-harming, learning different ways of coping. So have a look at that as well.
Great, thanks Nicole. So I'd like to thank the panel. So we have Tess, Sarah and Nicole for coming in today.
Thank you.
Thank you for watching this. We hope that you have got something out of it, and we look forward to seeing you again next time.
Bye.